Hello and welcome. I'm so glad you are here today to join this important conversation. We're going to talk about something that many people experience but often feel too shy or embarrassed to discuss: pain during sex. If this is something you have ever wondered about, or perhaps experienced yourself, please know that you are not alone in this journey. This topic deserves our attention, our understanding, and our compassion. The goal today is to shed light on a very common cause of this discomfort, to demystify it, and to empower you with knowledge and practical solutions. So, grab a cup of tea, get comfortable, and let's dive into this subject together, with openness and without judgment. Before we get started, if you find this information helpful and believe it could benefit others, please consider liking this video and subscribing for more content dedicated to your health and well-being. Sharing this knowledge helps us build a supportive community where these topics are no longer taboo. Pain during sexual intercourse, known in the medical world as dyspareunia, is a topic that definitely needs more open discussion. It is far more common than most people realize, affecting many individuals at some point in their lives. The feeling can range from a mild, temporary discomfort to a more severe, persistent pain that can significantly impact your quality of life and your relationship. This pain can be felt at the entrance of the vagina, deep inside the pelvis, or anywhere in between. It is crucial to understand that this is a valid medical issue, not something you just have to put up with or endure in silence. Your comfort and pleasure are important. There are many potential reasons why someone might experience pain during sex. These causes can be physical, emotional, or a combination of both. Physical causes can include skin conditions, yeast infections, bacterial vaginosis, structural issues, endometriosis, pelvic inflammatory disease. On the emotional and psychological side, stress, anxiety, fear, past trauma can cause the pelvic floor muscles to tense up involuntarily, leading to pain. So what exactly is vaginal dryness? Let's break it down in simple terms. The walls of the vagina are naturally kept moist and elastic by a thin layer of clear fluid. This moisture is essential for the health of the vaginal tissues. It helps to keep them thick, healthy, and stretchy. The hormone estrogen plays a starring role. Estrogen stimulates glands in the cervix and the vaginal walls to make natural lubrication. When estrogen levels drop, fluid production decreases significantly. That leads to vaginal dryness, vaginal atrophy clinically. Think of it like this. Healthy tissue is like the inside of your cheek: plump, soft, moist. Low estrogen makes it more like the skin on the back of your hand. Thinner, less elastic, drier. That tissue change causes problems. Without enough natural lubrication, the delicate vaginal skin can become irritated. During sex, friction from penetration against dry, thin tissue causes tiny tears, burning sensations, and outright pain. One of the biggest misconceptions about vaginal dryness is that it only happens to women who are going through menopause. While it is true that menopause is a very common cause, it is certainly not the only one. People of all ages can experience vaginal dryness for a wide variety of reasons. Understanding these causes can help you identify if this might be what is affecting you. The primary trigger, as we have discussed, is a drop in estrogen levels. So, any life stage, medical condition, or treatment that causes estrogen to fluctuate or decrease can potentially lead to vaginal dryness and discomfort. Let's talk about menopause first, as it is a major factor. As a person with ovaries approaches menopause, their body's production of estrogen naturally declines. Perimenopause, postmenopause, beyond menopause, there are many other situations that can cause a temporary or long-term drop in estrogen. Childbirth, breastfeeding. After giving birth, estrogen levels plummet, and while a person is breastfeeding, the hormone prolactin suppresses estrogen. This is why many new mothers experience vaginal dryness and pain during sex. Certain medical treatments, such as chemotherapy, radiation for cancer, can also damage the ovaries and halt estrogen production, leading to dryness. Other causes can include the surgical removal of the ovaries, which induces immediate menopause. Some medications, particularly certain types of hormonal birth control that contain low doses of estrogen or only progestin, can contribute to dryness in some individuals. Even some allergy and cold medications that contain antihistamines can have a drying effect on mucous membranes throughout the body, including the vaginal tissues. The most well-known symptom of vaginal dryness is pain during sexual intercourse. But, the discomfort does not always stop there. The signs and symptoms can affect your daily life, even when you are not sexually active. Recognizing these other symptoms can help you connect the dots and realize vaginal dryness might be the issue. Soreness in and around the vagina, itching in and around the vagina, burning in and around the vagina. It can be a constant, nagging irritation. Uncomfortable to sit for long periods, uncomfortable to wear certain types of clothing, uncomfortable to even go about your day. You may experience light bleeding after intercourse or spotting after intercourse. Dry, fragile tissues are more prone to small tears from friction. Those tears can be painful and may bleed a little. A sense of tightness at the vaginal opening, which can make inserting a tampon difficult and painful, or make a pelvic exam feel painful. Urinary health can also be affected. The urethra sits very close to the vagina and is influenced by estrogen. Low estrogen can make urethral tissues thin and irritated. This can cause increased urgency of urination or increased frequency, feeling like you have to go all the time. More frequent urinary tract infections can occur. Once you suspect vaginal dryness might be causing your discomfort, there are many things you can do to manage it, starting with simple, accessible steps. Consider your daily hygiene routine. The vagina is self-cleaning. Avoid harsh soaps, avoid douches, avoid scented products. These disrupt pH and strip natural moisture, which can worsen dryness. Wash the vulva with warm water only, or a very mild, unscented soap. Arousal matters. Allow plenty of time for foreplay before penetrative sex. Arousal increases blood flow to the genitals and stimulates lubrication. Rushing means less natural moisture. Communicate with your partner about what feels good. Prioritizing foreplay can improve comfort, even with low baseline moisture. Hydration and overall health help too. Water isn't a cure for hormonal dryness, but staying hydrated supports tissue health. Dehydration can make dryness worse. Avoid irritants. Choose breathable cotton underwear. Avoid synthetic fabrics and strong detergents, and skip fabric softeners with perfumes or dyes. When lifestyle adjustments are not quite enough, the next and most effective step for immediate relief from pain during sex is to introduce a good quality lubricant. It is essential to understand the difference between a lubricant and a vaginal moisturizer. A lubricant is used right before or during sexual activity to provide temporary slipperiness and reduce friction. A vaginal moisturizer is used regularly, perhaps every few days, to help restore moisture to the vaginal tissues on an ongoing basis. Think of it this way: a lubricant is for function, while a moisturizer is for overall health and comfort. Let's talk about lubricants first. There are three main types: water-based, silicone-based, oil-based. Water-based lubricants are very popular and safe with condoms and sex toys, and they are easy to clean up. However, they can dry out during use and may need to be reapplied. Silicone-based lubricants are more slippery and last much longer than water-based ones, making them an excellent choice for significant dryness. They are also waterproof. Oil-based lubricants, including natural oils like coconut oil, olive oil, are also long-lasting, but they should never be used with latex condoms as they can cause the latex to break. Vaginal moisturizers are absorbed by the skin and adhere to the vaginal lining, mimicking the body's natural moisture. They help to rehydrate the tissues and can improve their elasticity over time. When choosing any of these products, it is very important to read the ingredients list. You want to avoid glycerin, parabens, perfumes, or flavorings, as these can be irritating to sensitive tissues. Over-the-counter products and lifestyle changes can help many people, but it's important to know when to see a doctor. If your pain is severe, if it does not improve with lubricants or moisturizers, if you have unusual bleeding, if you have abnormal discharge, if you have pelvic pain outside of sex, these could be signs of another condition that needs diagnosis and treatment. Preparing for your appointment will help you make the most of your time. Your doctor is your best resource to get to the bottom of this. If vaginal dryness from low estrogen is confirmed, your doctor can discuss prescription options. The most common effective treatment is local estrogen therapy. This is not the same as systemic hormone pills. Local estrogen can be a cream, a small vaginal tablet, or a flexible vaginal ring. It delivers estrogen directly to vaginal tissues with minimal absorption elsewhere. For many, it's a safe, effective way to restore moisture and elasticity. We have covered a lot of ground today, from understanding what vaginal dryness is to exploring the many practical solutions available. The most important message I want you to take away from this is that pain during sex is not normal, and it is not something you have to silently endure. You deserve a sex life that is comfortable, pleasurable, and fulfilling. Your body is not broken. You are not alone in this experience. This is a common health issue with very effective solutions. Taking that first step to acknowledge the problem and seek information is an incredible act of self-care and empowerment. The journey to resolving sexual pain begins with knowledge and communication. Communicating with yourself to understand what your body is telling you, communicating with your partner so they can be supportive, communicating with a healthcare provider who can offer expert guidance. Remember the tools we have discussed: gentle hygiene, prioritizing foreplay, using high-quality lubricants and moisturizers, considering medical treatments like local estrogen if needed. There is a path forward, and you have the power to walk it. You are worthy of pleasure and well-being. Thank you so much for taking the time to watch this video. I hope you have found this information to be helpful, reassuring, and easy to understand. Now, I would love to hear from you. Do you have any questions? Is there anything in this video that resonated with you? Please share your thoughts, experiences, or questions in the comments section below. Your voice matters, and your story could help someone else feel a little less alone.